Dr. Parris is a cardiologist and current resident of Baton Rouge, Louisiana. She is the owner and operator of the Parris Cardiovascular Center and specializes in the diagnosis and preventative care of cardiovascular disease.
You'll start seeing their face drooping because they're affecting some of the facial arteries on your face, their lip. You tell them stick their tongue out, it'll go to the side, so it should be straight. And then at that point of time, you need to call 911, okay? So we can actually stop a stroke from being catastrophic. If you can get the person within 6 hours, hopefully within 2 hours. Within 2 hours, you can actually reverse the stroke. We can push blood thinning medicines in, we can break that clot up, and the person looks normal again.
Dr. Emily Harville is an associate professor in the Department of Epidemiology and co-director of the Center for Emerging Reproductive and Perinatal Epidemiology at Tulane School of Public Health and Tropical Medicine.
We also see that Black women are more likely to develop certain complications of pregnancy. The disparities aren't quite as stark, but more likely to develop gestational hypertension, preeclampsia, which is hypertensive disorders of pregnancy. And one thing I think is kind of interesting, there isn't really a disparity in gestational diabetes, but there is a disparity in women coming in to pregnancy with diabetes. So I think that's one of those ways where it's really important to look at the whole life course, not just like the pregnancy by itself, because there's the combination of both the pregnancy and what's happening before. And so what we see then is that these combination of all these risk factors put Black women at a higher risk for severe maternal outcomes. And there's been a lot of attention paid lately to maternal mortality. You've probably heard about that. But fortunately, maternal mortality is still quite rare, even though it does happen, and we have a strong disparity there. But if we look at every case of maternal mortality, there's at least 70 cases of severe maternal morbidity, life-threatening complications of pregnancy, and the most common reason for those are cardiovascular complications.
Ms. Sheronda Edinboro is the founder of the I Choose Me Health Project and the founding president of the Capital City Black Nurses Association in Sacramento, California.
So now that I've learned more about myself and who I authentically am, I have recognized that I have a right to have my needs met and practice self-care. I am cognizant now of my feelings and when I need to reach out, even though it is difficult at times, because I know I cannot afford to go backwards in time and journey down that road once again. When I'm depressed, I disappear. I no longer do the things that I enjoy or talk to people I care about and love. I isolate. And I know I must reach out and get help sooner rather than later. I also know that when I reach out, my close friends know not to just say, "Girl, it'll be all right," or "You got this," because I really may not be all right, okay? Or I may not have it all together. But instead, they know to provide a shoulder to cry on until I make it to that appointment to talk with a therapist, and they know just to be present for me and to allow me to ride the wave and sit in my feelings. They know how to be my friend. Okay.
Troy Byer is a psychologist, author, director, screenwriter, and actress who's also an expert in stress and emotional regulation, a certified heart math trainer, and a certified anger management specialist.
So that night, as I sat in Paris Hilton's former cell, I had to take some personal inventory. I had to stop and I had to reflect on some things. And I realized that everything and everyone that I ever loved or valued were no longer a part of my life, and they weren't a part of my life because they didn't want to be around me and my anger all the time. Even still, I wasn't willing to admit that I had a problem, because in our world, to admit that you have a mental issue or mental challenge is so looked down upon. And I just didn't have the heart to say that about myself yet. And I was embarrassed and ashamed that I knew that was my reality, but I couldn't come clean with that. So the next morning I went before the judge, And he said, young lady, I've got the solution for you. You're going to do 52 weeks of anger management. And I started to argue with him. I was like, I don't have an anger issue. He's like, it's going to be 104 weeks in a minute. I was like, I'm good.